It's Dr. Jim. Welcome back to some more information on COVID-19. This time I want to focus on just the basics, giving healthcare professionals the basics, giving non-healthcare professionals the basics on this virus. So let's start with very basic stuff. What is a coronavirus? Coronavirus, or COVID-19 for short, belongs to a family of viruses called coronaviruses. And they are named this due to the crown-like spikes on their surfaces. And on our webpage and my blog and whatnot, we have images of coronaviruses so you can see them. And I'm sure you've seen them already. Originally, these viruses only infected some animals like bats, pigs, perhaps snakes, and other small mammals. The viruses, though, have the ability to mutate, making it possible to jump from an animal to a human, and now from person to person. So, breaking it down, 7 coronavirus strains are known to infect people, including the new virus, which causes respiratory illness. 4 of these viruses cause the common cold already, and the other 2 are highly deadly and cause severe acute respiratory syndrome, or SARS, and Middle East Respiratory Syndrome, or MERS. The technical name for the new virus is severe acute respiratory syndrome coronavirus 2, or you might see it as SARS-CoV-2. The disease that this virus causes is simply COVID-19. COVID-19 has very specific symptoms in most cases. COVID-19 infects and causes problems in the lower respiratory tract. When signs and symptoms first emerge, they generally include a fever, cough, aches and pains, and eventually shortness of breath. It can also cause severe complications from pneumonia. Now, we've heard about those symptoms. Some of the less common symptoms that we're not hearing about a lot include a sore throat, chills, headache, nasal congestion, and gastrointestinal problems like vomiting and diarrhea. Most people will experience mild symptoms and even no symptoms, though they are carrying the virus. Over a short period of time, they may experience more severe symptoms and become very ill. Others will develop what we have called walking pneumonia, which means that people are not sick enough to know that they're sick or that they have the illness, and they're not seeking help from a doctor or going to the hospital. And they are more likely spreading the virus through close contact with other people. Although we are practicing social distancing, I think, which is becoming a very effective tool. If the virus cannot jump from me to you, it's got nowhere to go. And that seems to be working pretty well so far. Now, the risk and the severity, let's talk about that of COVID-19. The global mortality rate around the world is somewhere between 2 and 3.4%. So it is low. In Wuhan, China, where the virus first developed, it did have a mortality rate that started out at almost 6%. It was actually 5.8 to be exact. But other areas of China experienced a lower rate of 0.7, not even 1 full percent. On a positive note, according to the media, and again, this could change, I get it, the rate has steadily decreased in China over time. Chinese government said, stay in your homes, don't come out, shut the factories down. People listened, especially in Wuhan and Shenzhen, and they stayed inside. In those areas, now we are talking about, trusting a communist government. So I'm going to take this with a grain of salt. But the cases are much lower to 0. You could take that for what it's worth, right? So the overall mortality rate here in the United States is much less, roughly 1%, which, by the way, is worse than the seasonal flu, which carries a mortality rate of about 0.1%. In other words, COVID-19, I know people have compared it to the flu, it's still deadlier. COVID-19 is deadlier than the seasonal flu, and that's why we have to take it seriously. But it is less dangerous than SARS, which also originated in China. In 2002, as a matter of fact, SARS spread around the world and killed around 10% of everyone who became infected with it. That's a high number. COVID-19 is also less deadly than both MERS and Ebola. I'm just putting this into perspective. It does appear that COVID-19 spreads from person to person much easier, though, than SARS. Individuals at the greatest risk are those who are older or have severe health care problems and chronic problems like heart disease, immunodeficiency problems. So I would say older adults with HIV are at a very high risk. Diabetes, chronic lung disease, and cancer. And as a gerontologist, my focus is on seniors, older adults, older Americans, older folks around the world, people in skilled nursing homes, assisted living, getting home health, people on hospice services and respite services. These are all individuals who might need greater attention, okay? All states in the U.S. now have reported cases. West Virginia, you were hanging in tough for a long time, but finally you had some cases. But other states like, California and New York have some of the highest numbers of infection. How does coronavirus spread? The primary way that coronavirus spreads from person to person is through respiratory droplets from talking, coughing, or sneezing. The droplets are projected into the air and can land on the other person's nose, their mouth, their eyes, their face in general. And that other person can inhale the virus, and then the virus begins the infection process. The virus is now known to land on surfaces like desks and computers, keyboards, telephones, briefcases, lamps and doorknobs and paper. And it can survive from hours to days. A person becomes infected by touching the surface, right? And then something that we do so many times a day. I actually asked my wife last night, I said, how many times do you think you touch your face during a day? She's like, oh, I don't know, probably not that much. I'm like, really? Think about it. Consciously think about how many times you touch your mouth and your eyes and your face and your nose and blah, blah, blah. Experts, and then try to stop doing that. Experts indicate that respiratory droplets are rather heavy and they do not travel long distances. That's why somebody came up with the 6-foot rule, and now I hear it's a little longer, maybe 7, 8, 9 feet from people. Stay away. This means that maintaining close contact with other people is the most likely way to become infected. Because of this knowledge, people are told to remain at least 6, 7, 8, 9 feet away from each other now. Especially stay away from people who are sick or symptomatic. How long does this virus live on surfaces? Research has already shown that the coronavirus can live on various surfaces for quite some time. It could live, according to research, on plastic and stainless steel for up to 72 hours. Disinfect any plastic, any stainless steel surfaces. It can survive on cardboard and copper for around 24 hours. The good news is it degrades rapidly after those time elements, after 24 hours, 72 hours. And the virus just degrades and dies. That's good news. Very small droplets, though, which are called aerosols, carry the virus for about 3 hours, but then disintegrate, thankfully. This is why it's vital to constantly wipe down and disinfect surfaces that are commonly or communally touched. Here's some final thoughts. Coronavirus comes from a family of viruses that experts have been aware of for quite some time. This new virus causes the disease. This new one causes COVID-19, which has several distinct symptoms. It's best to know as much as possible about this illness for healthcare professionals and for everybody else, and to prevent the spreading in every way we possibly can. Knowledge. In this case, in the case of COVID-19, knowledge is power. I'm Dr. Jim, and I'm going to keep trying to give you as much knowledge as I possibly can. So keep coming back. Knowledge is power, and we're going to beat COVID-19. See you soon.